or major vertebrae here. You touch and feel there is a prominent vertebra. There is a prominent vertebra, that is the bulge is there here. That on the cervical bulge to be known as a seventh cervical vertebra. So otherwise you wanted to see, you just turn your neck region, right and left turn here, yes, right and left, yes. You place it like this, you touch and feel C1, this is the hairline from here I will count. So hairline above, that is C1, C2, where the hairline is C2, C3, C4, C5, C6, C7. Now the prominent bone to be known as a C7. Then below the C7, then find out the another bone, that bone to be known as a thoracic one. Thoracic one, remember in the right. So now let me see the thoracic C7. Below that you press and then feel this is the T1 vertebra. The T1 vertebra below that. So each vertebra, not the T1. Below the T1 vertebra, 1.5 tune lateral. Now you make it as a mark it C7. This is the C7 vertebra. This is the T1 vertebra, C7. Then this is the T1 vertebra.
Sir, please zoom that area.
Sorry, zoom that area, right? Yes.
You can't see.
Yes, 1.5 tune lateral to the lower border of the spinous process of the T1 thoracic 1 vertebra. So this point to be known as a UB11 point. UB11 point bilaterally, you just activate this point. Anything you remember, this is the majorly all the fu viscerous organs are connecting point. All the fu viscerous are connecting point. That's the reason DU14 and then UB11. Both the points are very important point to treat for the numerous head and neck related disorders and all the bone related disorders. Musculoskeletal disorders can be treatable by activating this specific point. Then the UB12, again you wanted to know 1 tune, nearly 1 tune below you can bring, you will get the idea. Otherwise you can find out give the pressure, because emaciated body is there, you can easily find out the vertebra. If the person is slightly obese and really little difficult to find, by the way, still at least you are not finding the proper location, you make it as a 1 tune below. Now UB11 in the shortcut I am telling you, UB12 and then UB13 and then UB14, UB15, UB16 and then UB17. Sir, how to find out this UB17? Now you can find out, there are the 3 locations. I will give you the information how to find out the proper locations. Now we completed C7 and T1. Now there is a vertebra is there. This is the scapular region. The pit of the scapula. The pit of the scapula, you come forward. Then you can find the thoracic 7. The pit of the scapula, you come forward, you can find the thoracic 7 point. In that way you can calculate. Then from here easily, C7 you can easily find out. Then come down, you can find the T1. Then below the T1 vertebra, UB11, UB12, UB13, UB14, 15, 16, 17. Here you find out. Here you find out the scapula pit. Otherwise you just take like this, yes. Something you can change the position, right. Easily you can find the pit of the scapula, yes or no. From the scapula you just come down from here. So this point to be known as a T7. This point to be known as a T7 point. T7 point. Now we completed the T7, that indicating how to insert the needle, that also very imperative. So we just apply the needle towards the spine. You just applied the needle towards the spine is advisable. Always you can use the 1 tune needle. Always apply the 1 tune needle towards the spine. This is the which branch? This is the medial branch of the, this is the medial branch of the vesical meridian, what we are seeing now. So therefore we just apply 1 tune below towards the spine is advisable. Once we connect this, the UB meridian points are connecting to the supporting to the spinal nerves. It's not directly connecting to the spinal nerves, indirectly connecting to the spinal nerves. By the way, it is connecting to the ANS, autonomic nervous system, but supporting to the sympathetic nervous system, especially by activating these 2 points. Now you remember UB 12 points. It's very imperative point to treat for all the lower limbs and also related to the lymphatic system. When the lymphatic flow is not good, how the blood circulation by heart, which is very much essential. Likewise, the UB 12 point also good point to treat for all the limbic system, and also this is the lymphatic system, not lymphatic system, to be regulated by activating this specific point. So therefore the spine alignment is not good, spine get deviation, scoliosis condition, or the lordosis condition, or the which we call as a kyphosis means here it will get the hunchback, the person will walk like this only, the neck cannot be straight. In that condition, certainly we can use this point to treat for whole the spinal cord or spine related disorders. These 2 points will be imperative. Now coming point is fissure. UB 13 is the fissure. UB13 is the fissure. Phi means is the lungs. This is the basic point, that. But UB13, 14, 15 is treatment for all the neurological disorders and also circulatory disorders. By the way, once you give the pressure, but where we applied on the right side, you are applying on the right side, this applicable for the right lung. You are applying on the left side, then it's applicable for the left lung of the disorders. So both the lungs, sometimes one lung is affected, sometimes both the lungs are affected, but you try to find out the sounds. If there is the murmurs or other kind of the sounds are there, shortness of breath, or the phlegm is accumulated, some kind of the one lung having the sound, the other lung is very clear. Otherwise, when you do the radiography, chest x-ray, so that time you come to know, yes, this lungs is very badly affected, collapsed, and this lung is okay. In that way, you just calculate and then apply the needle, or that sometimes the right nose is blocked, sometimes is the left nose is blocked, so that indicating both the lungs are impacted. Only the right nose is affected, then right lung is affected, vice versa. So then apply on the one specific needle, only 1 point is enough, or bilaterally you wanted to use it as a bilateral. Now the pericardium shoe, that you just apply towards the spine. Good. UB14 is the move front alarm point for the pericardium. Normally it's a good. And then UB15 point is good point to treat for the cardiac system. All the heart related diseases can be normally treatable. Now this is as a conclusion here I wanted to tell you. You wanted to use the move front and then back shoe point together. Always is good. For example, sin shoe you are applying UB15, which is the move front point for. So REN 14 you can add up REN 14 and then UB15. UB15 and then REN 14. Both the points you can activate at the time. So to treat for all the cardiac related disorders. But by the way, you wanted to focus. These points are applicable for the chronic diseases, but front points are treatable for the acute diseases. Then you don't know it is a chronic or acute. Then you integratedly you can apply back shoe point and then move front point together is advisable to treat for the numerous diseases of that particular organ related disorders. Right. Now we are talking about the next level of the point is UB16. UB16 and then UB17. UB17 is the back shoe alarm point for the diaphragm. Which is the diaphragm? DU16 for the pruritus, dermatitis or something related to the skin eruptions. You can use UB16. UB17 point for treat for all the blood related disorders. All the Shuve means is the blood. So therefore any blood deficiency is there, blood toxicity is there. All the conditions can be treatable. UB16 and then 17, both the points are good. When the patient feels, sir, I have the problem in my diaphragm is get catchy and the epigastric pain is there on this particular region, so that time certainly you can use the point called as a, because even for the female comes to us, so that time I cannot apply the needle over on that region. Then on the prone position, you just apply on the cloth, you just wipe it with the spirit and then insert the needle on the back shoe point is always is good, rather than applying the front needle, because we know the theory says front treats back and back treats the front, vice versa. Now we are talking about the UB15, then UB16 and UB17. So till this margin you can understand how to locate the points. Yes, do you have any doubts? No. Till UB17 we got clear. This is the one line to identify where the vertebrae are existing. Now come to this line. I will give you the short information, but this line to be known as a first tooth line, this second line to be known as a second tooth line. Give me that marker. Now I try to this press. From here you just press. From here you just press to the ribs, and then where it ends the ribs. Where it ends the ribs, that is called as a 12th floating rib. This rib to be known as a 12th floating ribs. From here you just come to the spinal cord. From here you just come to the spinal cord. This to be known as a first tooth line. This to be known as a first tooth line. TUFFIERS. First tooth line you can find out. This to be known as a second lumbar vertebra. Till this is second lumbar vertebra. Now hopefully we understand this is the C7, the T7, then the T8 vertebra, T9 vertebra, T10 vertebra, T11 vertebra, T12 vertebra, right? Then the L1 vertebra, then L2 vertebra. From here, then lower border, you can find the lumbar 2 vertebra. From here you just come down, and this vertebra is to be known as a L2 vertebra. Below that L2 vertebra the points are located. Now hopefully you try to find out this is the 12th rib. From the 12th rib you just come down, you can find the second lumbar vertebra till here. Now what are the points are existing? Start applying the needles. By the way, you will get the free treatment. Right, you just apply here. Yeah, this side only you just apply. This you apply UB17. Yes, UB17. Then please apply somebody UB18. Yes, UB18. Then UB19. Good, towards the spine, UB19. Then again UB20. 17, 18, 19, 20. 21. So now larger vertebrae are coming here. 22, 21, 22, 22, 22. You just perpendicular. Say God's name and then apply. Yes. Insert. Slowly you just insert. Don't worry. Relax. Relax yourself. Further deeply apply. Good. 2. Yes. Apply on the one more needle. You just apply here. Yes. Somebody. Otherwise, give to her. Yes. So one more needle. You just apply. Yes. So please, opportunities are there who wanted to come forward and then apply. Right. Good. Then, so you apply here. Yes. Good. So now somebody apply over the points here. Who wanted to come? Shagufta, just apply. Downwards direction. Good. Good. So somebody wanted to apply, you just apply towards the spine. Sir, Dr. Hanif ko dijiye. Sir, you just apply here. Yes. So 1.5 tune lateral. Here you just apply. Yes, good. Yes, you apply Madi. You just apply towards the downwards direction. Good. 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 Right. You wanted to apply? Yeah, you just apply from the, yeah, one thumb
Here I don't
maximum.
see anything.
Yeah, you just apply over here this region. Yes. Good. 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 So hopefully we applied for the maximum points over in this region to regulate the autonomic nervous system, to regulate the internal organs as well. Now,
The microphone is on.
now first to fierce line. I think just open the windows are open only, right? Windows are open. No, you wanted to see me or you wanted to see this image and my voice is clear or not clear? Please tell me. Not one person.
Hear anything, sir? Camera is shifting.
Not one person. All the people in the Zoom they cannot
I
hear.
hope it is muted, sir. Your camera is muted.
Oh, yes, yes.
Camera is mic is muted.
Yeah, now.
Okay.
Now, please you just listen carefully. Now, there are the three lines I'll tell you. One line to be known as this is the scapula, pit of the scapula line. The second line to be known as the first two fierce line. Otherwise, we can consider this as a first two fierce line. This to be considered as a second two fierce line. Then third line to be known as you can find where the normally the thread people Brahmins they use, normally they want thread, where will stop, where will hang that thread. So this the crease is there, this crease is the known as a iliac crease, this iliac crest crease. So iliac crest crease you just come forward, but this is coming forward, this to be known as a third to fierce line. This to be known as the third to fierce line. That indicating this is called as a fourth lumbar vertebra. This is the second lumbar vertebra. This is the fourth lumbar vertebra. This is the second. This is the third, and this is the fourth lumbar vertebra. So this is the fourth lumbar vertebra. That means these points are located. Which point is located on the fourth lumbar vertebra? UB25 point is located. Which point is located? UB25 point. Then this first two fierce line, which point is located? UB23 point is located. Which point? UB23 point. UB23 is the kidneys back shoe point. Then the UB25 point is the back shoe alarm point for the intestines. Then which is the back shoe alarm point for the endocrine gland or the adrenal gland? Back shoe alarm point for the adrenal gland to be known as a UB22. Now UB23 is over. Then UB22 point is where the Sanjo back shoe point to be known as a adrenal gland point. UB22 to be known as the Sanjo back shoe point, known as the adrenal gland point. So when we wanted, because do you know where is the suprarenal gland to be known as a adrenal gland? So where is it located? Above the kidneys. So kidney back shoe point is UB23. Above the UB23 point, UB22 point is located. So then the kidneys adrenal gland point to be known as a UB22 point. Whenever the patient is taking like a steroids and injections and they are already prone to get the autoimmune diseases which is connecting to the brain related disorder, the muscle related disorders where the good response is not taking place, or the autoimmune diseases, then hopefully I'll try to complete now. I'll give you some of the secret related to the spinal cord, especially on the sacrum region, how we need to connect and then treat. So now we completed UB20. No, this is as a UB25, 26, 27, 28, 29, 30. This is UB30 point. Where is the UB30 point? So that I can show them. This is, you can find this region. So you can find on the gluteus muscle. So now this is this region, all of you see this region, this called as a, this entire region will get the spinal cord. So inside there, what is the spinal cord is existing. Inside the spinal cord, what is existing? There is a fluid is existing. What fluid? Yeah, very good. CSF is existing. In that CSF, once you come down on the L2, the spinal cord get completed. On L2, spinal cord get terminated. That's called as the, from here the some vibration or some fibers are coming downwards direction, but that fibers are safe, will not cause any problem. Here the cauda equina get terminated. Where it get terminated? This is the, this area to be known as a filum terminale. This region, this region to be known as a filum, F-I-L-U-M, filum terminale. That means terminated till here. So this terminated to be known as a sacrum 4. This terminated region is known as a sacrum 4 vertebra. Then this is the coccyx. You put the finger from here, the coccyx is like this. Then you just open this, then the coccyx pain may not be there, right? See the secrets which is we wanted to know, you just try to. By the way, please don't make it any noise. As much you can grasp the situation is, maybe some network issues, I'm not very sure, but try to find out which is the most important concept. That much you keep it in the mind. Everything the physically and then Zoom, it get differs in normally, but however I'll try to give you the best of the best where you can able to grasp, you just grasp it. So now you understand. I'll try to find finalize now. This is the first toofiest line, scapula line. You remember scapula line. First you remember scapula line.
Yes, sir.
The second toofiest line you remember from here, the where it ends the ribs, that to be known as the second toofiest line, that is the second lumbar vertebra. Then you can find normally where the thread is there on the waist region, that this is the iliac crest. From here you just find out, from here you can find out, from here this is the iliac crest. You can find this is the pieces and all, it's existing here, but this is the iliac crest. From here you just come to the spinal cord. This to be known as a fourth lumbar vertebra. This to be known as a fourth lumbar vertebra. Which point is located? See, I complete. This is the iliac crest. You come forward to the spine. You can find the fourth lumbar vertebra.